Thyroid nodules are very common today, and for years we've relied upon 2D ultrasound to see what's inside the thyroid. But what if we could see more?
My name is Dr. Falahati. I am an endocrinologist. I have been practicing endocrinology since 2001 in Salt Lake City, Utah. To start with our 3D ultrasound, set this on top of our probe and snap it on. Start recording, start moving our probe from bottom to top, and then on the opposite side again, and we are done. Very simple.
The ease of use is time-saving, more reproducibility of the imaging. So a 2D ultrasound, it's a little bit more subjective. There's a lot of room for error for measuring the nodules. With the technology of the 3D ultrasound, I think you can track the nodules a lot more accurately.
What do you think are the advantages for the patient?
We live in a 3D world, and so seeing the nodule in a 3D form versus a 2D form can lead to a lot more understanding how the nodule is sitting inside of their body, what it might actually be doing, and help you understand your body and what's happening a little bit better.
6 years I've been helping patients kind of try to understand their thyroid nodules. I look at an ultrasound and I'm like, what? It's a bunch of blobs. If I could see, there's my nodule, the proportion of my thyroid, it's this much. That would be so helpful.
The patient can actually have this reference of, oh yeah, I saw that nodule and like what it looks like. They might be more inclined, better adherence to like our recommendations for like either repeating ultrasound or doing ablation of a nodule.
I'm also really adamant about using the newer technologies that are non-surgical, minimally invasive procedures where with a small intervention, we can reduce the size of the nodule and literally make them become almost non-existent in some cases, rather than sending the patients off to surgery to remove their entire thyroid. To do that, I need a very accurate diagnostic tool. PIUR Imaging's 3D ultrasound has been an amazing addition to a better planning of my procedures and interventions, knowing exactly where the nodule is at, what it looks like, and where is it in relation to some sensitive structures within the neck. We are now able to keep the current equipment we have and add PIUR imaging to our current existing ultrasound device. This is not a costly investment, and you have a state-of-the-art advanced level ultrasound system. The insurances did not even ask a question. So it almost doubles the collected claim. Every single case that I have submitted to insurances in the state of Utah have all been covered and without any questions asked. Bring this time-saving technology into your daily practice. Do not automatically assume it's a very complicated, costly process. It's much simpler and much more affordable than you think. We are just scratching the surface. 3D ultrasound has the power to revolutionize the way we do imaging of the thyroid going forward.